And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap between fitness professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 71, we're going to dive in a little bit more to what it actually means to be a fitness professional who is transitioning onto the healthcare continuum. And these are conversations I've been having with a number of different people lately. And it strikes me that although many fitness professionals talk about wanting to become part of our healthcare delivery system, and in fact, in some cases, they actually consider themselves part of the healthcare delivery system, so few actually understand specifically what it takes, not just to get there, but also to maintain your place within the healthcare delivery system. So that's what I want to talk a little bit more about here in episode 71. Just some of my thoughts and observations, talking to a number of very, very bright minds in the field in terms of what it is going to take for fitness professionals, broadly speaking, to become members of the healthcare delivery system. And again, to state, I think what is the obvious for this audience is that this is a necessary evolution in healthcare in our country. We talk about healthcare innovation a lot, and sometimes that's talked about in terms of technologies or best practices or interventions. But I firmly believe the most critical healthcare innovation that could take place is figuring out a way to allow everyone in the healthcare system to work at the top of their license, which fundamentally means that fitness professionals need to be involved in the process in terms of not only prevention of chronic cardiometabolic diseases, but also, and importantly, in the treatment of those diseases after they've been diagnosed. So this truly is a primary, secondary, and tertiary type of prevention strategy that we can be employing. Now, all that being said, there are steps that we have to take if we're going to get there. And we've had many guests on the Wellness Paradox that have provided thoughts on these steps. We've had many guests provide a lot of information to all of you, our audience, as to ways you can enhance your standard of practice. But I want to talk in terms of 4 areas in today's conversation that we need to focus on if we're truly going to move towards becoming a valid and consistent member of the healthcare delivery system in this country. And I'll summarize them in list form here, and then we'll dive in a moment. The first is appearance, so literally how we look, how are we presenting ourselves. The second is language, the terminology that we use. The third is competence, what we know and what we can do with what we know. And then the fourth is outcomes. And we're going to spend a decent amount of time talking about outcomes because this may be the area that we're lacking in the most as a community of fitness professionals. So for starters, I want to talk about appearance. And, at the risk of sounding, trite or superficial, appearance does make a big difference. Ultimately, first impressions are lasting impressions. And I want to paint a picture for you of something that I think you would find quite implausible, but then we'll abstract it out of the environment I'm talking about and put it into our environment. I think you see it becomes more plausible very quickly. Could you imagine walking into your doctor's office and your doctor was in shorts, tennis shoes, a t-shirt, maybe a tank top, or maybe if that's a bridge too far, think of walking into your physical therapist office and your physical therapist is in, a tank top, some shorts, some tennis shoes, maybe they have, piercings on their face and they have tattoos down their entire arm. You might think for a second, wow, this doesn't seem very consistent with healthcare. Now, I'm not suggesting that we turn into something that we're not as fitness professionals. And we do work in health and fitness club and gym settings. And in some cases, it's appropriate to be wearing certain apparel and attire that may allow you to exercise. But For the most part, for many of us, we are simply coaching our clients very similar to the way a physical therapist would work with one of their patients. So the first area that I want to encourage all of you to consider addressing when you think about what are the steps that I need to take to become part of the healthcare delivery system is the way you are presenting yourself. And I actually think a physical therapist makes a pretty good avatar for what we need to aim for as fitness professionals that are looking to transition onto the healthcare continuum. So some nice pair of athletic dress pants, it doesn't have to be the expensive ABC pants from Lululemon or something like that, but some reasonably nice pair of, athletic dress pants that allows you to move around and kind of gives you that freedom of movement. And then probably some kind of a collared shirt, a polo shirt. Again, not saying we need to be in a three-piece suit here, but I'm saying if you look at what people look like in healthcare, and the closest avatar that we can get here is a physical therapist, maybe an athletic trainer, we need to be considering our appearance relative to that. And I would also go on to say that particularly the younger members of our field that are listening to this, you need to be even that much more aware of your appearance. And again, saying nothing about the personal decision to get piercings or tattoos or things like that, but you have to ask yourself not how you feel about those things, but how the people that are interacting with you will perceive piercings and tattoos and things like that. Again, they're commonplace in the general fitness industry, in air quotes, but they're not very commonplace in the healthcare space. And if that's where we want to go, we need to start to adopt the appearance that those individuals have. And this seems like such a minor thing, and on some level it is, but in the whole thought of, majoring in the minors sometimes does have a degree of importance. This is also a very low risk, high mileage thing that you can do to immediately start to make yourself more amenable to people in the healthcare space. So appearance is the first thing to consider. The second thing to consider is language. And one of the massive issues that we face in just healthcare in general, but certainly in the gap that exists between the fitness industry and healthcare, is we all speak a different language. I was on a call recently with my good friend Amy Bantham and some other people who are working on an article for the ACSM Health Fitness Journal. And we actually had a conversation for a while of, do we call the individual that we're working with in this article, do we call it a patient? Do we call it a client? Is it a member? And at first, it's almost a laughable discussion, like, does it matter? But then you start to realize really quickly that language does matter, and it matters to a great degree. And so even this little conversation around client versus patient, we actually didn't even resolve it on the call. And it's almost comical. We thought this is a separate article in and of itself we can write. Now, when I talk about language, I'm not talking about possibly this endless circular debate between patient and client. When I'm talking about language, I'm talking more around the notion of, if we want to communicate with healthcare professionals, we are responsible for speaking their language, being able to use medical terminology consistently and correctly in all contexts. So that is in written word, in spoken word, if you're reading it, having a clear understanding of that clinical terminology is so important. Understanding abbreviations. The medical field, like many fields, is ripe with abbreviations and acronyms and things like that. Understanding what those mean, being able to use those freely, it makes such a difference. And this is something that takes a little bit of work and exposure to, but once you've gotten that exposure, it turns out that you can use these terms pretty freely and consistently. Now, what I'm not recommending, in the interest of health literacy, is I'm not recommending that you use technical terminology with clients. In fact, I think that could be a significant misstep. But what I am recommending is, when you are interacting with another allied health professional, particularly people with higher level licenses like physicians, using their terminology and being able to communicate with them on that level is critically important. And I think it's not only important to suggest that you have a working knowledge of at least the aspects of medicine that you need to be able to effectively work with referred patients, but I also think it's important because doctors don't have a lot of time, and we don't want them to have to spend their time translating our language into their language. Our time is every bit as valuable as theirs, no doubt about it. But if we are going to make this a reality, we have to realize that the fastest way to do it is for us to learn and translate our language, into theirs. Here, a very, very simple example: the difference between high blood pressure, hypertension, and the abbreviation HTN. So if I'm sending a medical clearance form to a physician, I could write high blood pressure on it, I could write hypertension on it, or I could write HTN on it. They all mean the same thing, but that physician is most used to reading the abbreviation HTN for hypertension. Or we could say heart attack, we could say myocardial infarct, or we can say MI. The physician is most used to reading MI. And it's just little things like that that go a long way to building trust and equity with that physician. So what do you do here? Well, in the first case of appearance, maybe it means you have to go shopping and buy some slightly more professional clothes. Here, in the case of language, it means acquainting yourself with medical terminology. And there are many medical terminology books that you can purchase on the internet. There are certainly courses you can take. I would have no doubt that there's a free course from Coursera that's out there that you could take, but this information is accessible to you. Now, moving kind of down the path here of areas to focus on, and I think somewhat intrinsically tied with language, is this idea of competence. So do you know what you need to know? And then are you able to apply what you know? And this in and of itself can be a very, very long conversation. And at the risk of making this a far longer conversation than what it needs to be, I do want to delve into these waters with the realization that this area is being worked on by many, many high-level individuals in our industry. And I've been a part of some of these conversations and grateful to be involved with them. Graham Billstrom from the Physical Activity Alliance, their It's Time to Move initiative, the work that they're doing, ACSM and Francis Nerick, the work that they're doing, the U.S. Registry of Exercise Professionals, and all the work that they're doing. A lot is happening around the competence element of this transition. But I think we first need to talk about just kind of a general hierarchy of competency development. And I'll break this hierarchy down into a foundational level, a middle level, and then an upper level. So the foundational level for competence, I firmly believe, and I'm not alone in this belief, is a 4-year degree from an accredited academic institution. Now, that is a complicated statement for me to make, but let's just break it down and make it simple for starters. So 4-year degree in exercise science, exercise physiology, some kind of related discipline. Normally, they're one of those two types of degrees. Ideally, this comes from an accredited institution, and program accreditation is something that is becoming more widely talked about. And many times it's talked about in the context of what happens in the medical field. So I'll pull an example that Francis Nerick from the ACSM uses quite often. In nursing, in order for you to graduate nursing school and sit for your board exam for nursing, you have to graduate from an accredited program. That means that some third-party accrediting body has said that this program has the necessary elements that allow you to competently sit for your board exam. Now, this is an area we're running into some issues in exercise science around the country, because if you go to University of Michigan for a degree in kinesiology and applied exercise science, if you go to Ohio State, if you go to Texas, if you go to UCLA or any other school around the country, they will all be exercise science curriculums, but they will all have different elements to them. and there's no uniformity in terms of curriculum. And that's something we need to move towards, and we are moving towards. Currently the ACSM and the NSCA both will require, I believe NSCA is 2030 and ACSM is 2027, that in order for you to sit for their degree-based certifications, in the case of the NSCA, that's the CSCS, and in the case of the ACSM, that's their exercise physiologist certification, you have to come from an accredited program. So this is work that is underway. For those of you that are past the college stage at this point, I don't believe this is going to apply to you as directly. I feel like, based on everything I've heard and understand, if you have a degree from an exercise science program that occurred in the past, so what we'll refer to as kind of a legacy degree, you could still sit for these degree-based certifications. But nevertheless, this is something we need to move towards. And if you look at athletic trainers and physical therapists before us as people who worked in the exercise portion of allied health, there are accrediting bodies for physical therapy programs, for athletic training programs that allow for consistent standards to be applied across academia. However that process unfolds, it will unfold likely over the course of the next 5 to 10 years. Having a degree is foundational. So if you're listening to this and you have a degree, great, you've taken that first step. And I suspect a lot of our listeners have that. In other cases, you may not have a degree, and maybe you've been in the field for a little while, and maybe there is this thought that, hey, if I want to go there, I may have to, and when I say go there, if I want to become a fitness professional who is part of the healthcare delivery system, it may require you to go back to school and to finish a bachelor's degree in exercise science or some type of related area of study. No different than if at this point in my career, I wanted to go become a physical therapist or an athletic trainer, I would actually have to go through that curriculum. So foundationally, everyone needs a degree. Over time, we progressively need to move towards accredited degree programs. So everyone in the healthcare delivery system knows that no matter what school you went to, you graduated with a degree that has a consistent academic curriculum and produces consistent competencies, knowledge, skills, and abilities. From there, there is the move towards becoming a certified professional. And this is where I think the conversation for years has been, degree or certification. And I think that's a really inaccurate and kind of reductionistic way to look at our profession. Just like in physical therapy, you graduate from physical therapy school, or athletic training, you graduate with your athletic training degree, but then you sit for board examinations, you sit for a certification exam. That actually suggests that you have the operationalizable skills and abilities, the practical skills and abilities to do the job. And when we look at this in the health fitness space, particularly moving on to the healthcare continuum, it's pretty clear to me that the certification that stands head and shoulders above all the other certifications is the American College of Sport Medicine's exercise physiologist certification. If you're looking to work with athletes, the analogous cert is the CSCS. But without a doubt, if there is anything that is closely associated with a board examination for exercise or fitness professionals, it is the ACSM-EP certification. And so when you're thinking about developing competency and credential, it is first having a degree, and then second, sitting for the highest level credential you could sit for, which at this point would be the ACSM-EP if you're working with general population clients. And if athletes, and this is probably less of a conversation on the healthcare continuum, it would be CSCS. So I think it's not degree or certification. It is necessarily degree and certification. And then after that, there's the ability to do specialty certificate programs. And I'll use the kind of analogy looking at physicians. A physician goes to med school, and then after they get through med school, then they have to just pass their basic board exam for whatever specialty they're focusing on. Let's just say, this is, some kind of, general surgery or, primary care, but then they can get specialty certifications, or they can get specialty credentialing. And an example of this would be, being certified by the obesity medicine board or something along those lines. So get additional credentialing. And that's something that we can do in our field. And I think if we're going to work with the special populations that are referred to us from medical professionals, if we're going to become part of the healthcare continuum, this specialty certificate emphasis needs to be on those populations. And there are a number of groups out there that offer this. On its most basic level, the ACSM offers their exercises medicine credential. We've talked about that in previous podcast episodes. Definitely almost a requisite specialty certificate to get if you're going to work with these populations. ACE has their medical exercise specialist. There are many other specialty certifications out there for specific conditions. Example, ACSM has their autism certification. They have their exercise oncology certification. The MedFit network offers a series of courses and certifications. So there's really this three-tiered hierarchy. There's degree, ideally at some point from accredited programs. There's certification, and then there's specialty certificate. And if you're really going to be an effective healthcare-based exercise specialist or fitness practitioner, you need to have all three elements. And then, of course, as I've always said, your best teacher over the course of time will be the clients that are put in front of you. So even having those three tiers of our hierarchy of education does not necessarily make you the expert that you need to be to work with these individuals. So it becomes incumbent upon you, when somebody comes to you with a specific medical condition you've never worked with before, that you do everything you can to learn everything there is about it from a pathophysiology standpoint, in terms of what the evidence base suggests with regard to exercise intervention. And you really start to dive into some of these conditions because they are complicated. And no one's asking you to become a medical professional here to diagnose and treat the condition, but it is incumbent upon you, if you are going to go in this direction, that you need to have a firm understanding of the medical conditions that you're dealing with. Again, ACSM's Exercises Medicine, their newly revamped curriculum, I believe it is 11 common chronic conditions that they talk about in that curriculum. And I think that would be a great introduction. And then the ones you find yourself consistently working with, you can dive deeper and deeper into the literature and the knowledge base for those particular areas. I'd like to take a quick break from today's episode to tell you a little something about one of our sponsors. As all of you are well aware, addressing the wellness paradox is a lifelong passion project for me. And when you're going to go on a long journey, it's difficult to go it alone. You need to find like-minded individuals that are willing to go on that crusade with you. And that's exactly what I found at the MRF Institute. The team over at the MRF Institute creates educational content for fitness and wellness professionals who are serious about becoming a part of our healthcare continuum. Getting on the healthcare continuum is all about leveling up our skills to be looked at as that valued resource provider. The wellness paradox is certainly an avenue for you to do that, but we need many different levers to pull if we're going to get there. And the MRF Institute is definitely one of those levers. You can go to their website, mrfinstitute.org, to find all kinds of great, informative, free informational content. And if you choose to engage with any of their paid content, they've created a coupon code specifically for Wellness Paradox listeners. You can enter in WP 2022, that's WP, and then the number 2022 to the website at checkout to receive a 15% discount on your purchase. I highly recommend you go check out mrfinstitute.org. Now back to today's episode. So the last area I want to talk about here, and this is going to become a touchy subject because I think I'm going to strike a nerve with some of our listeners, is the idea of outcomes. Healthcare is outcome-based. Bottom line, that is how healthcare works. Healthcare talks about outcomes consistently. What outcomes are you producing? What outcomes are you producing for the cost? And this is where we have, I don't even want to say we have failed on a significant level. We have failed monumentally in our industry to produce consistent outcomes in fitness and health that we can attribute back to the programs that we are implementing. Yes, on a broad-based level, everyone understands that exercise is a good thing for you. If you become more cardiovascularly fit, if you become more muscularly fit, we understand that is going to be a better thing for you as a human being for your health. But medicine is not interested in abstracted generalities. They're interested in objective specificity in terms of outcomes. And this is where we need to get much, much, much better as a field. And I'm going to talk about this on a couple different levels. The first level I want to talk about it is the level that we can engage on right now in our practices, is being able to provide evaluation on broad-based fitness outcomes. And I use the words broad-based specifically because traditionally our industry has focused on body composition as the monolithic outcome that everyone must achieve. We must get people to a healthy BMI or a healthy percentage of body fat, or we must help people get their beach bod or whatever we want to call it. And in doing so and being so monolithically focused on this one outcome, we've done two things. One, because it's so hard to influence the outcome of body composition. And we're not going to get into all the research on that right now, but it is incredibly hard to substantively reduce someone's body weight and keep that reduced weight off. The outcome we've tried to consistently produce, we have failed on an epic level. We just have. Yes, there are the few success stories that you see out there. And yes, there are the before and after pictures. But I always say, what's the after picture look like? So there's the before picture, there's the after picture, and then there's the after picture. And I would venture to say that a lot of those after pictures look exactly like the before picture, or pretty darn close, right? So body composition is just a complicated thing to address. It really, really is. And I realize that many of us that are in fitness, we're doing this because we want to improve our body composition and we want to look a certain way, and that's absolutely fine. But that's for the 15% of the population that already engages with us. You've heard me talk about this many times. We're great at making the fit fitter, the lean leaner, but how does that improve population health? Healthcare is not interested in that population because that population isn't going to see them in the first place. So they're not the bulk of the costs that need to be dealt with in our healthcare system. So I think we, because of our own perspective as fitness people, it's skewed the outcomes that are actually important for the clients and the patients that are getting referred from healthcare professionals. So if the first problem is we've chosen an outcome which with the general population is nearly impossible to effectively influence directly through our scope of practice, because our scope of practice is specifically exercise. It's not necessarily nutrition, which is a big part of these interventions to lose weight. So if the first issue is we've chosen an outcome that we can't effectively address and we haven't effectively addressed, the other thing that we've done is we have greatly diminished the purview of what it means to improve your physical fitness for health-related purpose. As the ACSM talks about, health-related physical fitness is more than just body composition. It's your cardiovascular fitness. It's your muscular fitness. It's multi-dimensional in nature. And when we reduce it down to the number on the scale or the percentage of body fat, we really do a tremendous injustice to what we can provide people. So I think we need to start to think more broad-based about our outcomes, particularly outcomes that are associated with fitness and health, because these are the ones that we can actually influence. I know if somebody exercises and my prescription is reasonably valid, they will improve their cardiovascular fitness, they will improve their muscular fitness. That's almost a guarantee if they do it. However, I can't guarantee that someone's going to lose a certain amount of weight and they're going to keep it off, because that is just a complicated proposition every day of the week. And it's even more complicated given the fact that our scope of practice doesn't really delve into nutrition very much. So what am I saying here? I'm saying as fitness professionals that are looking to be medical fitness professionals or looking to be part of the healthcare delivery system, we need to get very good at coming up with a broad series of health and fitness related outcome measures. We need to be very good at administering those at baseline and administering those periodically throughout our time working with an individual so we can track change in their physical fitness and their health. And ideally, you could start to tie these physical fitness measures, so have it be VO2 max, muscular strength, muscular endurance, body composition to a degree. I don't think that should be taken out of the equation. That's certainly part of it. And you could tie those to improvements in their health. Wouldn't it be great that if you could show that over a 6-month period of time, someone improved their VO2 max by 15%, their muscular strength by 18%, their muscular endurance by 13%. And oh yeah, during that period of time, their blood pressure dropped, their cholesterol dropped, and their fasting blood glucose and A1C dropped. Like, wouldn't that be great if we could tie those two things together? Because then we have a powerful and compelling argument. And better yet, if you're getting clients to adhere to a consistent assessment protocol where every 3 months they're doing this, you can actually provide them information that they take to their doctor and show their doctor on annual physicals or other appointments. Like, hey, here's how my fitness is improving. And then you start to get the doctor say, wow, okay, like I see your fitness is improving through all these metrics. And oh, look at this, your blood panel is looking a lot better. When I do your CBC, when I do your lipid panel, when I look at all these biomarkers of cardiometabolic health, they seem to be trending in the same direction, same positive direction as your fitness. These two things could be related, right? So I think you see where I'm going here. We have to, if we are going to move on to the healthcare continuum, we have to be about measuring outcomes and then consistently remeasuring those outcomes and being able to report that data back to other members of the healthcare team, physicians, nurse practitioners, physical therapists, dietitians, it goes down the line. We have to be outcome oriented. And that's the first level, and I think the most foundational level that all of you can address. Now, you want to take this a step further. You can then start to associate this improvement in health and fitness based upon the biometrics that we can collect and also match up with what's getting collected in the clinical setting. Then you could start to tie them to claim and cost data. And then you really have a compelling argument for what we could do. I firmly believe that individuals that improve their cardiovascular fitness, their muscular fitness, and their body composition to whatever degree we can improve it, I firmly believe that they have a lower healthcare spend and they utilize healthcare services on a lower level. I believe it. And anecdotally, I can tell you many cases where that is true. However, we've not yet proven this on a broad basis. And this is the pot of gold at the end of the rainbow. If we could start to show that consistent programs produce consistent outcomes, which result in some kind of knock-on effect on healthcare utilization and healthcare spend, then we get everyone's attention. That's what gets people's attention. And I know it exists if, as a community, it just can't be one or two professionals out there. It has to be as a community of health and fitness professionals. We are willing on a broad basis to collect this data, to aggregate it, and to use it to make the very, very valid and logical claim with the evidence that we can tell this narrative around, hey, we improve fitness parameters. We also improve health. And by improving health, we reduce healthcare utilization and we reduce healthcare spend. All of these, I think, very salient and important issues. Now, again, I can go on all of these things for a very long amount of time. But to recap, we have our 4 focus areas: appearance, look the part; language, speak the part; competencies, be able to do your part of the process well; and then outcomes, be able to document in tangible, objective terms what your competency can actually produce. These are the things that are required of us if we are going to become part of the healthcare delivery system. And if the sooner we can wrap our head around these 4 things, the sooner we can move there. But it just can't be 1 or 2 isolated practitioners. This needs to be a concerted, grassroots effort at a critical mass if we are actually going to get there. We can get there. We have all the ability to get there. The conditions are right for us to get there, but we have to start doing things in a uniform and a consistent fashion. So that's what I'd like you to consider from this conversation is what it takes to become a member of the healthcare delivery system. We say we want to be there. I believe we have what it takes to be there. We need to put in the work to be there. And I think if you're listening to this, you're willing to put in the work. So that's kind of what I want to leave you with from today's conversation is I've laid out a framework and a path here for you to start to consider to go in the direction on this journey of becoming part of the healthcare delivery system. As always, I appreciate your time. I appreciate your passion. I appreciate your critical thinking around all these things that we talk about. Any additional information that I'd like to share from this episode can be found on the show notes page. That's going to be found on wellnessparadoxpod.com/episode 71. Please be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again next week, please be well.